Canada has lost its measles elimination status. So the Public Health Agency of Canada says it was notified of the status change from the Pan American Health Organization due to a large outbreak. This began in October of 2024 with more than 5,000 cases reported since. And Canada had held measles elimination status since 1998. The PHAC says status can be regained once transmission of the strain involved in the current outbreak is interrupted for at least 12 months. I had a chance to speak with several medical professionals about the re-emergence of measles. Now, I'm joined live by Dr. Daniel Salas, Executive Director of Pan American Health Organization's Comprehensive Immunization Program. Dr. Salas, thanks a lot for joining us. So we have to talk about this. You know, going back to, 1998 is when we held this status, measles elimination?
Yeah, thank you. Thank you. I think that Canada has been making a lot of efforts actually to stop the outbreak. And we can say that, I mean, of course, the status is important, but we can say that the situation in Canada, it has been getting better. The number of susceptibles that has extended in this kind of close-knit communities probably is getting to an end. And with it, probably the outbreak that has been sustained for over a year. But I don't think that the situation is actually the same. I think that Canada, unfortunately, didn't get the 12 months to stop the outbreak, but eventually in the coming, month and a half or something, the outbreak is going to come to an end.
What exactly does losing measles elimination status mean, and what does that do?
Well, the status, of course, it's important. It's like a goal that we all achieve to sustain once that it has been achieved. But, the consequences are the real, thing that is of most concern to countries in terms of if you have sustained transmission, it means that you're going to have some cases that are going to have complications or are going to be hospitalized. Of course, there's the risk of having deaths. For example, in Canada, there was a report of 3 deaths during this current outbreak, and a lot of consequences. It's not just the encephalitis or the blindness that can happen because of measles. Recently, it has been discovered that measles can attack the lymphocytes, defense cells, and can cause amnesia in many immune amnesia. It means that the children that are affected with measles, even though they don't have complications, they could have a mild case of measles, but in the next 2 or 3 years, those children are not going to be able to fight against many of the diseases that are common for humankind. So they need to recover that kind of memory, and even there is an encephalitis that can manifest like 7 to 10 or even more years later. And usually this encephalitis, it is caused because the measles virus remains dormant, in the body of a person. Usually is fatal. So there is a lot of consequences, social disruption, interruption, in classes at schools. Productivity comes. It's a lot of things that are going on in the background, and actually, that's what is really of most concern. It's not just losing the status or not. In this case, as I was mentioning, Canada has managed to at least have good coverage in general. The outbreak has been very concentrated in these close-knit communities, and we haven't seen this spill over to the general population. So it seems like Canada is going to end the outbreak probably soon and not later.
Okay. Dr. Daniel Salas, Executive Director of Pan American Health Organization's Comprehensive Immunization Program. Thank you.
My pleasure.